I'm Ehsan Malek from Case Western Reserve University at Cleveland. I want to talk about two major studies that we did on TGF-β signaling pathway in myeloma space. The first one is the synergistic effect of TGF-β inhibition with Bortezomib inhibitor, specifically Vactosertib, the third generation Bortezomib inhibitor for myeloma that actually is FDA approved. And second one is synergistic effect between TGF-β signaling pathway and Pomalidomide, that is third generation immune modulatory drugs approved for myeloma. In the first study, we showed that in the immune competent mouse myeloma, that a compound called Vactosertib, that is TGF-β receptor inhibitor, a small molecule, is active against this immune competent murine myeloma. So we have single agent anti-myeloma effect as well as synergistic effect with Vactosertib. Specifically, these agents suppress T regulatory and myeloid-derived suppressor cells in this mouse model. So we count it as an immune stimulator, and we have a data that shows that has a synergistic effect on inhibition of autophagy that is very important in overcoming resistance to Bortezomib inhibitor. And so we showed that is a synergistic effect with Vactosertib in this mouse model. In the second abstract, we showed that this compound has synergistic effect with Pomalidomide also, with almost the same mechanism. Basically, these compounds suppress T regulatory cells and myeloid-derived suppressor cells, therefore unleash the immune system against myeloma. Also, we briefly summarized the 5 patients' data on clinical trials. That phase 1 clinical trial on Vactosertib, this compound, TGF-β receptor antagonist with Pomalidomide. We went through 2 dose levels, 6 milligram Q daily for 5 days, 2 weeks off, and then 120 milligram Q daily for 5 days and 2 weeks off. And we showed that in 5 patients that we recruited so far, we have 6 months, 100% progression-free survival rate. That in compared to historical control, that is only 20% PFS at 6 months, it's a promising result. Of course, we have only 5 patients, but so far is tolerated very well. We have only 1 grade 3 adverse effect that was just skin reactions, and we had 100% progression-free survival at 6 months. So we are excited to go to extension cohort of this trial, and we go from there. Okay, we're good.